We'll do the SC joint. Pull at the end. Can you imagine neck pain in this such a young bride? हम पूछते हैं कि नेक पेन कैसे हुआ, कब हुआ और कितना है।
1.5 साल से ये दर्द है। ये दर्द हाथ में जाता है और झनझन करने लग जाता है।
क्या करने में तकलीफ होता है?
कोई भी काम करती हूँ तो उसमें गर्दन झुका के करना पड़ता है, उसमें दर्द होता है। फोन यूज करने पे दर्द होता है।
So the common factor, neck आगे झुका के काम करना, like this poor postural habit, you will certainly have neck pain because आपका ये जो मसल है वो पकड़ नहीं पाएगा सर का जो वेट है, इसीलिए दर्द होता है। उनका कुछ स्लिप डिस्क की तरह हुआ है in the neck region। एक्सरे देख लेते, उसके बाद we will start to doing the treatment। Noticing the lateral view of X-ray of the सर्वाइकल स्पाइन या नेक, जो ये कर्व होता है सीक टाइप का कर्व नहीं है, पूरा सीधा है, एंड दैट इज बिकमिंग अ प्रॉब्लम। मेक श्योर दैट शी गेट्स बैक द कर्व। सो लेट्स सी how it's done based on chiropractic and osteopathic treatment. We have to reduce this bump or hump which medically we call is Dowger's hump. उसके ऊपर C0 C1 से स्टार्ट करेंगे, धीरे धीरे नीचे मिड ऑफ सर्वाइकल स्पाइन, फिर सर्वाइकोथोरैसिक जंक्शन में आएंगे। बीच में हम ग्लेनोह्यूमरल जॉइंट या शोल्डर जॉइंट भी टारगेट करेंगे ताकि वो पीछे आ जाए। शोल्डर्स जो है वो आगे है, which means that is her shoulder is rounded. We have to pull it back through exercise protocols. एकदम ढीला। We'll do a little bit of superior distraction. Decompression भी कभी-कभी बोला जाता है। एकदम ढीला करो, relax. बस, perfect. Left shoulder joint, relax. Wow. Push hard. One more time. There you go. She is a professional baker and she is extremely good at that. Right now, tell you her Instagram handle. If you guys want vegetarian baking like cake or any type of baking cuisine, you can certainly go and connect her. So what's your Instagram handle?
Bake Blossoms by Prerna.
Go into Instagram, find it, and ask her to bake a beautiful eggless cake for your birthday. She also have a Facebook page by that same name, so you can also go ahead on Facebook and search for her. When she gets better and she's already a rock star, she'll bake one cake for us then.
Yes, sure.
All right, nose to niche. Now this is the major part. We are going over CT junction because she has a lot of bump on the CT. There you go. I love that. Now we'll go over the thoracic spine, mid thoracic spine, and a little bit of the lower thoracic spine. There you go. You should be hearing that. And one more time. There you go. Acha, सीधा सुन. We'll do the SC joint. Done. And a little bit of AC joint with a pull at the end, holding at the suboccipital, because I am pretty much certain suboccipital muscles will be completely tight, tensed and cramped up. On the other side. There you go. There. Now উঠে বসুন, best এটাই, হ্যাঁ। All right, relax. Hold on to your hands. Done. Now we are again doing mid thoracic and at the end range. Bam! We will be using my favorite hammer and chisel. Alright, उनका basically दो जगह है. First is neck and then she also has low back. Currently we treated her उनका जो neck, गर्दन and also the thoracic spine यानी upper back. So let's ask her to move her head on right to left. सर घुमाइए right left and बताइए कि if you have any pain or anything. Right.
नहीं, मेरे का पहले से काफी better है.
At this point of time, she is not feeling any pain. We are going to teach all the postural correction and corrective measures. उनको बताएंगे. Hopefully you like the video. Please do comment, subscribe and follow. Please don't forget ping her on Instagram and Facebook. Her link will be and down in the description. You can click on the link and then give her a call. The phone numbers and other contact information will be listed under her page. So other than that, thank you so much.
Stay fit, stay healthy.